Hi, my name is Diaz, and I want to become a physical therapist because I am fascinated with the human anatomy and its relation to movement and rehabilitation, and would love to expand upon this knowledge and utilize it in a way that will help and benefit other people. A good example of a time where I persevered through a difficult time would be last year when I did not receive admittance into a physical therapy program. After applying to over 15 schools, I was discouraged not only to find out that I didn't get into a PT program, but also because the majority of my friends that I had graduated with had full-time jobs and were making good money and moving on in life, and I felt as though I was falling behind in life. At this time, I contemplated whether or not I should continue pursuing a career in physical therapy or if I should just get a full-time job elsewhere. Ultimately, however, I decided to continue pursuing a career in physical therapy because I realized that it's my passion and it's what I want to do the rest of my life. In order to improve my application this time around, I decided to do a few things. The first was to retake the GRE. The second was to retake 4 classes, 2 of which I have already received A's in, and the other 2 I am currently taking now and have A's in. The last thing I decided to do was to continue working as a therapy aide at JAG Physical Therapy, where I initially started off as a volunteer and worked hard as a therapy aide in order to get a full-time job offer recently by the owner of JAG Physical Therapy. So now, after doing all of the aforementioned things stated earlier, I feel much more confident in my application this time around and hope that I will receive admittance into a physical therapy program this time. Body language and communication are an integral aspect of the field of physical therapy and is definitely something that I feel comes naturally to me. Whether I'm working with a patient, walking them through an exercise routine, or simply just talking to them about how their day is going, I always try to maintain eye contact and stay attentive the entire time. Referring to a patient by name is also something that I've learned helps the relationship between a patient and a therapist. Another thing I try to do to enhance the communication between myself and a patient is to speak clearly and directly. A good example of this is working with the Spanish-speaking patients that we get at JAG Physical Therapy. Because of the fact that we've been recently getting a large amount of Hispanic-speaking patients, I took the initiative to continue learning and build upon my knowledge of Spanish, and I've been working and improving my Spanish each day when communicating with patients. Another thing that helps, especially when working with difficult patients that may be a little impatient, is being nice, extra kind. That goes a long way. The last thing that helps in communicating with a patient is understanding what you're talking about. It's important to understand the mechanics that go into perfecting an exercise. This is important because it allows me to be able to communicate more effectively to the patient what exactly they need to do in order to get the right form for a particular exercise. Therefore, all of these are things that I work towards improving each and every day I come into work at JAG Physical Therapy. Thank you for your time, and I look forward to hearing back from your admissions committee soon.